Today on Student Nurses Success, we're going to start our GI series. This first map is just going to cover some general gastrointestinal and nutritional information. The other maps will cover the pancreas and gallbladder. I have a map that covers liver, and I also have one map that covers the rest of the gastrointestinal disorders from the stomach, small intestine, and large intestine. Let's go ahead and get started. Remember, you can find the link to the maps in the comments section. Let's begin by just talking a little bit about some anatomy and physiology with the GI system. Remember, digestion is really aided by lots of different things throughout the GI system. Amylase and lipase are produced by the pancreas, and amylase and lipase are digestive enzymes that help break down food. So, in disorders that involve the pancreas, individuals may not make enough amylase and lipase, and so they may have trouble breaking down their food. We talked about this with cystic fibrosis. Cystic fibrosis is a disease of exocrine gland disorder, and in those individuals, they often have to take additional amylase and lipase in order to break down their nutrients in order to absorb them. Your stomach makes hydrochloric acid and intrinsic factor, which help break down food as well. Throughout your intestine, there are many other enzymes that help break down the food. There's just too many of them for us to cover in this lecture. Your liver is responsible for making bile, and bile helps break down bilirubin, and it also helps break down fats. Now, your small intestine is primarily in charge of absorbing nutrients. So, individuals who have small intestinal disorders may appear more malnourished because they're not able to get enough nutrients. Your large intestine is primarily responsible for absorbing water and fluids. I'd like to cover a couple age-related concerns for you to keep in mind. With the older adult, they usually have decreased taste and smell, which can decrease their amount of food intake. It's just not as pleasurable to eat if things don't taste and smell good. They also may have a loss or a change in their dentation or teeth, which is going to reduce their ability to chew their food. Chewing is the first part of digestion where we kind of mash up our food, and saliva has digestive enzymes that start the process. In the older adult, motility is also slowed throughout the gut. Because of this, they have increased risk of constipation. They may have loss of sphincter control, and they also have poor thirst mechanism, which also increases their risk of dehydration. Now, infants, motility is not well coordinated in the infant GI system until they're about 3 to 4 months old. Also, infants, because their esophagus is so small, so short, and their sphincters are not mature enough, we see a lot more spitting up. Let's talk about a few of the general manifestations you're going to see in all of these GI disorders. Now, each GI disorder won't have all of these manifestations, but you could have a range of any of these. Dysphagia, which is difficulty swallowing, and dyspepsia, which is heartburn. These we'll see sometimes with esophageal and stomach disorders. Nausea, vomiting, anorexia, and anorexia meaning not feeling like eating, are very common as well in GI disorders. Now, diarrhea is really defined as somewhere around three loose, watery stools. So, one or two loose stools a day is not necessarily diarrhea. But when we're talking about diarrhea, we're talking about multiple watery stools that occur in a short period of time, meaning within maybe the day or a half a day. There are different types of diarrhea. There can be inflammatory and secretory diarrhea, which are related to pathogens, maybe viral gastroenteritis, parasites, or even bacterial types of infections. We also know that sometimes gut motility is increased in individuals, and that causes diarrhea. Osmotic diarrhea is from the ingestion of a large amount of solutes. Um, Sometimes, if you eat a large amount of sugar or a large amount of fat, what that does is it pulls fluid from other parts of your body into the actual intestines, which then causes watery stools. Constipation is a very common complaint as well. With constipation, we see as we get older it being more common. So, constipation is a common problem in older adults. We also know that decreased fluids, decreased fiber, and decreased activity levels will also affect constipation. So, in order to decrease constipation, what we really recommend is increasing fluids, fiber, and activity. Abdominal pain is a common complaint as well with GI disorders. We talk about the quality of the pain. So we ask individuals to kind of, is it sharp? Is it burning? Is it deep? Is it visceral? So having them describe the pain is helpful. There are a lot of structures throughout the abdominal area, and so it does get to be hard to really pinpoint sometimes where the pain is at, and sometimes the symptoms are all very vague in nature, and that's not uncommon with GI disorders. We often ask people to identify the location of the pain, and specifically which quadrant. Is it the right upper quadrant? Is it the right lower quadrant? Is it the left lower quadrant or is it the left upper quadrant? These help us identify where the problem is. If the pain's in the left upper quadrant, we think stomach. If it's in the right upper quadrant, we're probably thinking gallbladder or maybe liver. If it's in the right lower quadrant, that's typical of an appendicitis. And if it's in the left lower quadrant, that's often typical of some type of colon problem. The last general manifestation we see is gas, bloating, and distension. These are very common as well, especially in malabsorption issues. Let's talk about our malabsorptive disorders. Malabsorptive disorders are really defined as the failure of the small intestine, because remember, the small intestine is really the one who absorbs the nutrients. So it's failure of the small intestine to absorb or normally digest dietary components. When this happens, we often see gas and cramping, pain, maybe loose stools, diarrhea because we're not completely digesting the food. And because of these impaired uh, absorption and impaired ability to really digest and break down food, we may see impaired fluid absorption as well. There are three malabsorption disorders we're going to talk about. The first is celiac disease. Celiac disease is really defined as intolerance to gluten. And what we mean by gluten is wheat and binding products. So we have a lot of gluten in different types of food products that help them kind of bind together. So, cookies, for example, often contain wheat, but they also contain gluten, and that helps make your cookie a cookie and not a pile of crumbs. So, it kind of binds things together. So, there's a lot of gluten in a lot of different binding products. So, vitamins. Like Flintstone vitamins or different types of vitamins can sometimes include gluten because they use it as a binding agent. Now, celiac disease is an immunologic response, and this immunologic response is a genetic issue. So those are individuals are genetically susceptible. What happens in these individuals is when they ingest gluten, this immunologic response leads to inflammation and damages the intestinal villi. So inside your GI tract, you have all these little fingers that help absorb and break down nutrients and release enzymes. And when in someone with celiac disease, when they ingest gluten, it actually damages the intestinal villi and destroys them. So, what we see is more than just kind of symptoms of, oh, my stomach's bloating, but you're actually doing real damage to the intestines. We know that celiac disease, if you are ingesting gluten and you have celiac disease, you are increasing your gastric cancer risk. Manifestations include weight loss because you're not able to digest your food well, pale stools, anemia, even rashes from this immunologic response, diarrhea, abdominal pain, and bloating from the malabsorption. Now, for those who have celiac disease, if they avoid all gluten, they won't have those symptoms, but they must avoid all gluten in order to decrease their cancer risk and to decrease their symptoms. So, strict adherence to a GF diet reduces that risk and also stops the damage to the intestinal walls. Now, lactose intolerance is the inability to digest lactose, and that's due to a lactase deficiency. So, lactase is an enzyme. And some individuals just don't have that enzyme. So if you don't have lactase and you ingest dairy products, you have nothing to break those dairy products or that lactose down. And so you can't absorb it and it's not broken down. Patients will then experience bloating and gas, pain, and cramping from this non-digested lactose. We often see diarrhea as well. Now, some individuals may tolerate small amounts of dairy if they eat it with other foods. So, if it's a small amount of cheese mixed in with other foods, they may be able to kind of overpower and tolerate it. But if they can't, the easy solution is to take Lactaid. And Lactaid is an over-the-counter, um, like pill or chewable thing that you can take. And so if you want to enjoy some dairy products or some ice cream or cheese, if you just take a Lactaid, you'll give yourself a dose of lactase and you'll be able to digest and break down that lactose. The other option is just to avoid lactose or dairy. Now, dumping syndrome is the quick dumping of stomach contents into the small intestine. In a normal situation, your stomach should slowly break down the food and slowly release it in small amounts into the duodenum or the first part of the small intestine. But with dumping syndrome, what happens is a large amount of food from the stomach is just pushed right into the small intestine. And the small intestine just gets overwhelmed. It cannot handle a large amount dumped into it. It's just not designed that way. The causes of dumping syndrome may be post-gastric bypass surgery or if you eat a large volume of hyperosmolar food. So, for individuals who have gastric bypass surgery, they have a smaller stomach, or they're not using their stomach. And so, because of that, they really have to eat very small meals. In somebody who has had gastric bypass surgery, if they eat too large of a meal, they will experience dumping syndrome because of that small stomach. They'll actually get a bolus of food into that small intestine too soon. We also know that if you ingest a large amount of hyperosmolar food, let's say you eat a whole bag of candy or a whole bunch of fatty food all at once, that high sugar or high carb or high fat amount that is ingested, sometimes your stomach just is overwhelmed by that. And it'll be like, nope, not having it. And it'll just dump it right into your intestine. So in those cases, those are probably your more common cause of dumping syndrome. And you think, okay, well, big deal. The problem is that with dumping syndrome, there can be some serious problems. What we may see is if you've ingested a large amount of sugar, carbs, or foods, we may see a rapid rise in blood sugar. Okay, so we see this big dump and this big rise in your blood sugar, and your body responds by making a whole bunch of insulin. The problem is that drives down your blood sugar very quickly, and the food has moved through your gut too fast, and so you end up hypoglycemic. And so you get signs and symptoms of hypoglycemia, which are kind of this sweaty, jitters, maybe just kind of feeling faint. You also can see rapid shifts in fluids and electrolytes because if the food dumps into the intestine, it's going to move very quickly through the body. And in fact, within a few minutes of eating it, you actually may have to run to the bathroom and have diarrhea. So that movement of fluid and that shifting of electrolytes can actually make you a little hypotensive and hypovolemic. And your response to that is even some tachycardia. So you're actually seeing some cardiovascular effects from this. And patients may have nausea, vomiting, sweating, and diarrhea as well. So the symptoms of dumping syndrome can, be uncomfortable and can actually even cause some hemodynamic shifts in the body. Now, I'd like to just call your attention to this little box down here, where I've made a little note because I think this is an important thing to consider. Food intolerance results in gas, pain, bloating, and dyspepsia. And food allergies are true allergic reactions that can be life-threatening. So intolerance, sometimes we eat a food that we're intolerant to. It just upsets our stomach. Lactose is mostly like our lactose deficiency is almost like a food intolerance. Okay, it's uncomfortable, but it's probably not going to cause an anaphylactic reaction. It just means that you're not digesting or breaking down the food well. However, a true food allergy causes an anaphylactic response. So sometimes people will say, "Oh, I'm allergic to that food." And if it is a true allergy, then that is a serious concern. However, sometimes people mislabel a food intolerance to with a food allergy. Maybe they say, "Oh, peppers, I'm allergic to peppers." And really, it's just that maybe peppers are something they don't tolerate well. So it is important to distinguish food intolerances from food allergies. Now we're going to talk about obesity. Obesity is a chronic condition and it's an excessive accumulation of body fat. We define obesity as a BMI greater than or equal to 30. And we define overweight as BMI 25 to 29.99. For children, if the BMI is greater than or equal to 95th percentile on the growth chart, then that falls into the obesity category, overweight category as well. Now, I know there's some talk that BMI is not the best method. It is not the only method to gauge obesity, but it is one way that we do use. It doesn't work for everyone. If you have a large amount of muscle mass in your body, your BMI is naturally going to be higher, and it does not necessarily mean that you're obese. So just kind of keep that in mind that BMI may not be the best indicator in all individuals. As far as the causes of obesity, we see multitude of causes. Some are lifestyle and diet, some are environmental. Maybe not access to good healthy foods, and maybe you don't have access to the high quality foods. Some of it's genetics; it just kind of runs in your family. We know that there's metabolic and endocrine disorders that increase weight as well. We know there's psychological factors where people maybe use food for comfort. And also pregnancy related. Individuals who are pregnant do gain weight. We do want them to gain weight, but sometimes women who are pregnant might gain too much weight. So it's important to kind of keep that weight gain in the recommended amount and not gain too much while you're pregnant. You should gain some, but you don't want to gain too much because it does get hard to lose over time. Now, when with obesity, once a fat mass has kind of accumulated, your body tends to actually set that as a set point, and it tends to resist reduction. And that's why, for example, when pregnancy, the recommended weight gain is somewhere about 25 to 35 pounds. But if you gain 60 or 80 pounds with a pregnancy, your body may actually use that as a new set point, and it may be more difficult to lose that weight. Not impossible, but it is challenging. We know that central or abdominal obesity is correlated with more cardiovascular risk. So we talk about the apple shape. When someone has most of their weight gain in their midsection, they're more apple shaped. If they have more of their weight gain in their kind of hip section, they're more of a pear shape. We know this apple shape is associated with increased risk of cardiovascular disease. As far as obesity, it is really it is a chronic condition and it leads to other chronic health conditions. It increases your risk of cardiovascular disease, which includes stroke, high blood pressure, and heart disease or coronary artery disease. It increases the development of type 2 diabetes. It increases sleep apnea. We know that there's increased in cholecystitis or gallbladder disease. We know that it can increase liver disease from increased triglycerides, and it can increase gastroesophageal reflux, and that's from increased intra-abdominal pressure, can cause refluxing of stomach acid up into the esophagus. It contributes to pregnancy-related conditions. We know it increases arthritis and joint disease. The more weight you have on your frame, the harder it is on your knees and your hips. Psychologically and mental health, it affects those as well. When we talk about treatment, lifestyle, dietary, and physical activity are the first things we try. Behavior modification and counseling can help us reset how we see food and experience food. Medications may be helpful in decreasing appetite. And we also know there are surgical interventions that can be used. One is gastric bypass surgery, where the stomach right here is actually bypassed and hooked into the small intestine. So it decreases the amount of food you can eat at a time. And it also kind of alters the way it's metabolized. However, there is more nutritional concerns with this surgery, and malnutrition is a risk. So patients do need to take often vitamin and mineral supplements. Gastric sleeve is right here, where we actually take away a part of well, we leave it in the body, but we'll kind of just staple that and make the stomach smaller. And that's going to decrease the amount of food that can be eaten and absorbed. And then the lap band procedure, which kind of just makes a smaller stomach so that you get full quicker. The last is eating disorders. We're not going to talk a ton about these. Often these are covered in your psychiatric mental health course, but eating disorders are abnormal eating patterns and also distorted perceptions of food and body image. The etiology includes genetics, biologic, behavioral, psychological, and social factors all contribute. Anorexia nervosa is really defined as a disturbed body image that results in excessive dietary restriction. These individuals actually see themselves as overweight when they look in a mirror, even though they may be quite thin. They just have this distorted appearance of their own body. We define it as a BMI less than 17.5, and they have irrational fears of gaining weight. Anorexia is life-threatening. We can see cardiovascular failure and serious altered electrolyte disturbances. So it definitely is a life-threatening condition at times when patients become so thin. Now, bulimia are episodes of binging and purging or episodes of fasting and may even include laxative abuse. The issue with bulimia, it's very secretive, and a lot of times their BMI actually falls into a normal range. So they outwardly do not always look exceptionally thin. So they may be kind of hiding in plain sight. Overeating and binge eating is defined as eating at least 2 days per week. I'm sorry, binge eating or overeating at least 2 days per week for 6 months. And it generally results in overweight individuals. And there we have it. So remember to subscribe and like our videos so that you're up to date on all our new ones. And remember to continue with the gastrointestinal series to learn about pancreas, liver, gallbladder, and other GI disorders.